It is here at the Kenyatta National Hospital that most patients with coronary heart disease come for medical care, given its affordability and availability of specialized health services. Kenyatta National Hospital is also the only public referral health facility in the country that offers open heart surgeries for patients with coronary heart disease. 54-year-old Daniel Kamau was admitted into Ward 7 close to 2 months ago after being diagnosed with coronary heart disease. The unbearable chest pains that left him gasping for breath was a clear indicator of a much bigger problem.
For some few kilometers nasikia maumivu kwa kifua. Kifua nasikia ni kama inawaka moto. Nikisidi zaidi ya hiyo kifua vile nasikia nikisidi ushugu inazidi na pumping ya roho nasikia mpaka nasikia naanza kuhema.
Dr. James Munene, head of the heart unit at the Kenyatta National Hospital, explains.
Now, when you run and you get tired and you feel like your legs are burning and things like that, you imagine your heart is like that. It's like you. You run and you get tired. Now, if your blood supply to that heart is not enough to take care of that added work, you get pain.
From my conversation with Daniel, I figured this was not a comfortable subject for him, preferring to avoid eye contact during most of our conversation.
Problem yangu, and what now they can do and what they can only save my life is by going through the operation.
Coronary heart disease is the 6th cause of deaths in Kenya, with approximately 9,200 people succumbing to the disease annually, according to a 2014 World Health Organization report. Kenya is ranked 149 in the world and 5th in East Africa after Tanzania and Uganda, with Burundi topping the list of the East African countries with the highest burden of coronary heart disease deaths. Despite causing a significant risk to health, non-communicable diseases received little attention and funding in the just-ending Millennium Development Goals. And as Kenya joins the rest of the world in adopting the post-2015 Sustainable Development Goals, Dr. James Munene says Kenya will not achieve the goal in the fight against non-communicable diseases, of which coronary heart disease is.
A guy who's asking for funds to treat malaria will say, look, I want to treat 40, 50,000 people, 100,000 people. The same money may only treat, 100 people for me. So when you say, have we achieved the goals, I would say not.
Investing in cheaper mechanisms like availing aspirin to patients with coronary heart diseases can not only avert heart attacks that can lead to deaths, but can also achieve up to 63 shillings worth of economic and social benefit for every shilling spent, according to a research by the Copenhagen Consensus Center. There are 12 theatres here at the Kenyatta National Hospital, out of which this one is actually dedicated to cardiovascular disease surgeries. But it can take up to 1 year for a patient to actually be booked in for surgery, and that explains why there's a backlog of patients on the waiting list. The waiting seemingly taking a toll on Daniel, having stayed in hospital for close to 2 months.
I used to be happy with my family, tunakaa pamoja, tunakula pamoja. Siku hizi mama kila siku ako kwa Malambala, Kenyatta, mtoto siwezi kupigia hata simu. Ndio nikumpigia simu. Anauliza dadi, kwani ulienda wapi? Nikimwambia niko job, unakuja. Nikimwambia nitakuja. Nasikia mtoto anarukaruka kwa nyumba. Yeye amesikia dadi anakuja. Sasa nikaona badala ya kumpatianga hiyo hope, sasa nikawacha kuwa naongea na yeye.
The permanent solution, however, is surgery for patients with the condition. So what's happening right now is that Daniel is being induced in preparation to go in for the surgery, which the doctor says will take about 3 hours. Dr. Munene will perform a coronary artery bypass surgery to restore blood flow to his heart.
These are the vessels that we use to bypass the blocks on one of the arteries or two of the arteries. So basically what I was doing is trying to remove it from the chest, which I've managed here. So now from here, I'm going to open the covering of the heart called the pericardium. Dr. Ruturi is already ready with the vein from the leg, and then we're good to go.
It is a delicate surgery that entails the removal of a vein from one of his legs, after which it is grafted around the area of narrowing.
The leg has many veins, and one of the veins is a deep vein, which is the most important one, and there's a superficial vein. There are 2 or 3 of them, the major ones in the leg. But this one is not a very important vein, so we can do away with it. We use it and sort of sacrifice it to help the other part of the body, okay?
And after 3 hours, Daniel is whisked to the ICU, where he will recuperate before being discharged from hospital. A week after, Daniel walked out of hospital after a successful surgery. And this is his parting shot to his friends and those who care to listen.
Mostly I have some friends we used to smoke with, like Kamau, Ilongo. Ningewadvise pia kama wanaweza wajaribu, wawache, wasijipate kwa ile shida kama ile mimi nilijipata bila kujua.
Marie Yambo reporting for Channel 1 News.